Rethink. Your life, your choice. Rethink.
Rethink.
Rethink. Your life, your choice.
Rethink. Your life.
Rethink.
Your choice.
Rethink.
Rethink.
Your life, your choice.
Rethink.
Rethink.
Your life,
Your choice.
Rethink.
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 Your life, your choice. Winnebago's Healthy Living Partnership.
Hello everyone, and welcome to Rethink, Your Life, Your Choice. We bring community leaders, advocates, and local residents like you together to find solutions to some of the most important prevention and health issues we are facing today. I'm your host, Emily Deeringer. Thanks for joining us. We're excited to transform Winnebago County into a community focused on improving health by implementing solutions that impact our residents where they live, work, play, and pray. Today, we are talking about STIs and the importance of open and honest parent-child communication. Our first guest is Jamie Orr. She has a master's in public health and is a health educator at the Winnebago County Health Department. Thanks for being here today, Jamie.
Thanks for having me.
You're welcome. So we're talking about STIs, and I have to be honest, am I living in the 80s? I thought they used to be called STDs. So can you kind of give me a little prequel to what we're going to be talking about today?
Sure. So to answer that, that's good. So we're going to refer to them today, and I may go back and forth between STI and STD. So STI is sexually transmitted infection. And why that was switched over, there's some stigma that follows sexually transmitted disease. There's many different things, but also STI and STD means the same thing. So if you hear sexually transmitted infection or disease, it means the exact same thing. And CDC uses one, books use one, we use STI, so it's the same thing.
Okay, super. So
Sure.
just to make sure everyone's on the same page, STIs equals STDs, and that's what we're talking
Yeah.
about today. So you're part of the Winnebago County STI Task Force. Can you tell me and the viewers a little bit about that?
Sure. So the Winnebago County STI Task Force was a group that was assembled in 2011, and this was to combat the rising STI rates in Winnebago County, and specifically among the age group of 15 to 24-year-olds. So to briefly describe, sexually transmitted infections are infections that are spread from one person to one person. Of course, one person has to be infected with some sort of STI. And they're spread through sexual intimate contact. So oral sex, anal sex, and vaginal sex are the three main modes of transmission for STIs. And two of the main ones, the ones that are diagnosed more frequently, are chlamydia and gonorrhea. There's also other ones such as syphilis, HIV, herpes, and HPV, which is human papillomavirus, and that's getting a lot of attention lately with the HPV vaccine, Gardasil. So the task force took a closer look at STIs, and we tried to better understand how best to reduce these STIs, and we did many different things. One was talking with different groups of parents, students, and healthcare providers in Winnebago County to see how we could better address the issue of the rising rates. So as you can see by the graph up here. So this is a graph of STI rates, and this is for chlamydia and gonorrhea, and this is in Winnebago County, 2007 through 2012. And you can see they're on the rise. And if we were to look at a graph nationally and also statewide, Wisconsin, it would be the same. So chlamydia and gonorrhea specifically are rising all over the nation.
So that's kind of an alarming graph, the frequent steady rise of STIs. So besides just the general rise in the numbers of people infected, why should we be concerned about STIs and the rising infection rates?
Well, the biggest thing with STIs is usually if you hear infection or disease, at least in lots of people's heads, in my head before I learned all of this stuff, you can maybe see symptoms of them. So if you have a disease or an infection, you can feel something or see something. With STIs, that's not always the case. A lot of the time, STIs are asymptomatic, which means they don't show any symptoms. And diseases without any symptoms, of course, can increase the likelihood of being transferred to other people through sexual contact. And so if a person has an STI and they don't feel it or see it, or if a partner has an STI, or your partner, for instance, a partner has an STI and the other partner cannot see it, then it's very dangerous because that could be passed between the two of them and on to other people as well. Also, STIs left untreated can cause serious health problems such as infertility both in men and women, cervical cancer, HPV, we know, human papillomavirus, is the leading cause of cervical cancer in women. There's many different strains of HPV. There's 4 that are considered higher risk strains, and that's the leading cause of cervical cancer, and also PID, which is pelvic inflammatory disease. And the cost of treating STIs in the United States is about $16 billion annually for treating the health problems associated with untreated STIs. So it's very serious.
It sounds pretty big time, and unfortunately, it's kind of a sensitive subject. So sometimes people don't want to talk about it, which is exactly why we're talking about it today. So, especially with the people that need the information more than anybody. So, do these infections only affect certain people, certain groups of people?
Well, they can affect anyone, but anyone having unprotected sex with a partner, an infected partner, could of course catch an STI. Both our statistics show that 15 to 24-year-olds have the highest rates of reported chlamydia and gonorrhea. And again, this is the same for local, state, and national. So this graph shows the big red circle. I love this graph. We use this in a lot of our teaching. The big red circle shows, and this is just for chlamydia. I want to point out, if gonorrhea were up there, it would look the same. In the age group of 15 to 19-year-olds, the second bar there, it shows up to almost 200 reported incidents of chlamydia in Winnebago County last year in 2013. And the age group of 20 to 24-year-olds is over 250. And these are just the incidents that were reported, meaning the person had to be tested and treated.
And just in Winnebago County?
Just in Winnebago County. So there's probably a lot floating out there that don't have symptoms that are not included here. So we also know that through a recent Youth Risk Behavior Survey YRBS data taken in Winnebago County, that as students in Winnebago County progress in grade, they also, their sexual activity also progresses. So the graph up here shows, I'm going to jump to 9th grade right there, the middle bar, because that's where high school starts here. In 9th grade, just over 20% of students have engaged in sexual activity, and by 12th grade, it goes up to nearly 60% of students engaging in sexual activity. And this activity can be any of the modes of transmission, anal or vaginal sex, which we all know can transfer STIs.
So that's a lot.
Yeah, it's a big deal.
Yeah. So, we're working with this population can be somewhat difficult, especially for, quote unquote professional adults. So this task force got together to brainstorm some ideas, kind of get more information from what's going on in the county, kind of couple it with this YRBS data. So what did the task force learn about the problem with STIs in Winnebago County?
So one of the things that we were able to do is perform an environmental scan of Winnebago County, which we were able to identify barriers which allowed us to assess the availability in the county of STI prevention, testing, and treatment services, and also educational services or opportunities or resources in the area. So we also learned, by doing this, we also held an adult focus group, which consisted of parents, medical professionals, teachers, things like that, people like that. And so through this group, we found out that parents have a large effect on their children's behaviors and on their values. And parents are rarely given the tools on how to talk to their children about sexual health because it's a taboo topic in a lot of areas, and here it is too, everywhere it is.
Mm-hmm.
And
except
so
on this show.
Except on this show, which is good. That's why we're here. So it is it's a hard topic to talk about, and parents don't know how to talk to their children about it, and children don't know how to ask their parents about it. So the primary area I'd like to focus on is parent education, and specifically parent-child communication regarding sexual health.
Excellent. So let's go into that a little bit more. So can you tell us why it's so important to have parent-child communication, good, quality, honest parent-child communication regarding sexual health?
Sure. So lots of evidence-based research shows that continuing parent-child communication about sexual health and also communication beginning at a very young age, it gives very good outcomes. It increases the likelihood that protection will be used when and if the child or teen or young adult does engage in sexual behavior. It delays the first sexual initiation, so it delays them from engaging in risky sexual behaviors. And also, it makes them more likely to seek testing and treatment services because they're comfortable about talking with their parents with it and getting the help that they need. And ultimately, it leads to fewer STI rates. And so this communication also allows, and this part I really like, it also allows parents to discuss their own beliefs and values with their children and encourage their children to make their own set of values or follow the family values, which we know is important. Values and choices is important in our behaviors. So the STI task force is led by the Winnebago County Health Department, and we're currently offering education to parents through a staggered handout, which we have, and then also parent classes held throughout the community. For example, we held most recent class at the Boys and Girls Club. We invited the community to, and it was this specific one was for parents and children together. And we were able to discuss the importance of communication, do some role playing with parent-child communication. And one of our partners with the STI task force is Planned Parenthood, which I really want to give a shout out to, because Planned Parenthood places a large emphasis on testing and treatment services. And they they can offer low-cost testing and treatment, sliding fee scale, all sorts of good things. And Planned Parenthood offers a wonderful resource, which I cannot say enough about. I cannot say enough about the Planned Parenthood brochure. It's a booklet called "Talking to Your Children About Sexual Health." So in this booklet, it really goes through how to talk to your children about sexual health by age. And I want to make a point to say that when we say talking to children about sexual health, when we say that, we don't mean give your 6-year-old all the information that there is out there about sexual health. That's not what we mean. And so Planned Parenthood's brochure talks a lot about, for instance, ages 0 to 2. It talks about how you hold your child, how you change your child, how you sing to your child, how building that comforting physical and emotional relationship with your child. And then it moves on to ages 3 to 5 and talks about the importance of calling body parts what they are. Don't make up little silly names for them, which we all do, or we all have, but it's important to get them comfortable with the body parts. And then it goes on to older ages, 8 to 12, for instance, talking about the puberty and reproduction. And then once we hit 7th to 12th grade, it recommends talking about the testing and treatment and protection services out there.
Awesome. It sounds like a great resource, and we'll touch on it again a little bit later. But right now we're going to break away actually to one of Planned Parenthood's community outreach coordinators, Margot Denucio, and she is going to be sharing with us and with our viewers a parent education class on how to talk to your child and how to give an open and honest create an honest conversation regarding sexual health. So we'll take it over to Margot from Planned Parenthood, and we'll be back here in the studio right after the presentation.